Welcome to the Neonatal Resuscitation, or NRP, Mastery course. This comprehensive guide is designed to boost your accuracy for nursing exams like NORCET, RRB, ESIC, and DHS. Neonatal resuscitation accounts for 4 to 5 questions in major nursing exams. Key learning goals include mastering the NRP 8th edition algorithm, understanding the difference between primary and secondary apnea, and knowing the appropriate use of PPV, chest compressions, and pharmacology. In primary apnea, stimulation like drying will restart breathing. If asphyxia continues, it leads to secondary apnea, which requires immediate positive pressure ventilation or PPV. Since you cannot clinically distinguish between them in the delivery room, always assume secondary apnea and start resuscitation immediately if the baby is apneic. Preparation is critical, guided by the TABC checklist: temperature, airway, and breathing. Remember that the single most important and effective step in neonatal resuscitation is ventilation of the lungs. The NRP 8th edition algorithm is based on the 60-second rule, or the golden minute. If the heart rate is less than 100 BPM, or the baby is apneic after 30 seconds, start PPV. If the HR is less than 60 despite effective PPV after 60 seconds, start chest compressions. The initial steps in the first 30 seconds involve providing warmth, positioning the head in a quote-quote sniffing position, clearing the airway if needed, and drying and stimulating the baby. Note the contraindication: do not vigorously slap the back or shake the baby. Let's review a previous year's question. A newborn who is breathing well, has good muscle tone, but has acrocyanosis, should receive routine care with the mother. Acrocyanosis is normal in the first 24 hours. Target preductal SpO2 is measured at the right hand or wrist because this blood supplies the brain and heart. Remember that it takes up to 10 minutes for a healthy baby to reach greater than 90% saturation, so do not rush oxygen delivery. PPV is indicated for apnea, gasping, or a heart rate below 100 BPM. The technique involves a rate of 40 to 60 breaths per minute. The best indicator of effective PPV is a rising heart rate. If the chest isn't moving, use the MRSOPA corrective steps. The sequence is mask adjustment and repositioning first, then suctioning and opening the mouth. If necessary, increase pressure or use an alternative airway. Chest compressions are indicated when the heart rate is below 60 BPM, despite 30 seconds of effective PPV. The preferred technique is the two-thumb encircling hands method, applied to the lower third of the sternum. The compression-to-breath ratio is 3:1. For endotracheal intubation, equipment sizes depend on the baby's weight. A helpful rule of thumb for insertion depth at the lip is the baby's weight in kilograms plus 6 centimeters. Epinephrine is indicated if the heart rate remains below 60 BPM after 30 seconds of effective PPV and 60 seconds of chest compressions. The preferred route is intravenous via umbilical vein catheter using a dosage of 0.02 milligrams per kilogram. Volume expanders are used for suspected hypovolemia or lack of response to resuscitation. Normal saline is the first choice, given at 10 milliliters per kilogram over 5 to 10 minutes. Warning: rapid push can cause intraventricular hemorrhage in preterms. For a 3 kilogram neonate needing endotracheal epinephrine, you would administer 3.0 milliliters of the 1 to 10,000 solution. Remember, the endotracheal dose is higher than the IV dose. The APGAR score system assesses appearance, pulse, grimace, activity, and respiration at 1 and 5 minutes. Crucially, the APGAR score is for retrospective assessment and is not used to guide resuscitation steps. The NRP algorithm is what guides the steps. For preterm babies less than 32 weeks, special thermoregulation is needed, including the use of a polyethylene wrap without drying. For ventilation, use a T-piece resuscitator to provide positive end expiratory pressure, or PEEP. The NRP 8th edition guidelines for meconium-stained liquor state that routine intubation and suctioning for non-vigorous babies is obsolete. The focus is now on immediate ventilation if the baby is not breathing. Post-resuscitation care is summarized by the STABLE mnemonic: sugar, temperature, airway, blood pressure, labs, and emotional support for the family. To quickly recap high-yield points, the most effective step is PPV. The compression ratio is 3:1, and the IV epinephrine dose is 0.02 milligrams per kilogram. Resuscitation may be stopped if there is no heart rate after 20 minutes. Neonatal resuscitation is about anticipation and preparation. master the algorithm, trust your assessment, and save the life. Thank you for completing this video.